Parliament has met for the first time since January as the country battles a worsening COVID-19 crisis.
1,606 cases in Category 1 and 20,128 cases in Category 2. Records the highest number of COVID-19 cases today.
Kuala Lumpur's migrant neighbourhoods are under siege.
Guys, I think our country will implement a total lockdown if COVID-19 cases in Malaysia worsens each following day.
I figure that we should stock up our food and non-food items.
Calm down. Let's wait for an official statement from the Ministry of Health for our next step.
I agree. Let's not start any speculation.
Okay then, I am positive that it will happen soon.
A few moments later.
Gas perlu terus diambil untuk membendung wabak ini daripada terus merebak.
Kerana itulah kerajaan kita melaksanakan perintah kawalan pergerakan yang mula
Gotcha! Oh my god!
The next day.
Good evening, I'm Dania Anwar. Thank you for joining me. Here's what makes news tonight. The total number of COVID-19 cases in Malaysia has drastically jumped to 50 after the country today recorded 14 cases in a single day. This is the largest number of cases recorded in a day after 7 cases were reported on March 3. Health Director General Dr. Noor Hisham Abdullah said these new cases belong to a second wave after the 22 patients from the first wave has recovered and discharged. The second wave began on February 27, 11 days after no new cases reported, Noor Hisham said in a statement.
Malaysia will not extend its coronavirus emergency when it ends on Sunday. Parliament has met for the first time since January as the country battles a worsening COVID-19 crisis. Prime Minister Muhyiddin Yassin has defended his government's policies as lawmakers clashed over his handling of the pandemic. Melissa Goh with this report.
It's been a couple of years since we last faced COVID-19 pandemic.
I know, right? Africans I wonder what Ministry of Health planned during the COVID-19 pandemic.
I appreciate everyone's punctuality at this meeting. Let's get started. To begin, we know Malaysia have a number of confirmed COVID-19 cases while we held this meeting. Ministry of Health is the center responsible in managing and surveillance of COVID-19 outbreak. Citizens wait for action taken by the Government of Malaysia and Ministry of Health to overcome COVID-19.
To minimize the number of affected citizens, I think we should close the borders and allow only Malaysian citizens to enter. But they also need to follow the mandatory 14 days of quarantine.
Also, we should enforce the STITQ, which is Search, Test, Isolate, Treat and Quarantine, which is a strategy to uncover suspected cases of COVID-19 in the community. Individuals who test positive should be hospitalized for the minimum of 14 days. We should also increase the quarantine centres in different parts of the country and with the help of National Disaster Management Agency, which they can help us to monitor the facilities.
To providing trusted source for information, the government prioritized the dissemination of accurate and reliable information to the public on developing mass media campaigns that aim at raising awareness, educating to the public on health protocols.
For that, I think we can do the SOP where public citizens are required to wear face masks every time when they are out. Also followed by social distance of 6 meters from each other.
I also think we need to implement the movement control order to break the chain of COVID-19, where we should close all the borders and everyone can go out freely except for essential activities.
Thank you all for your time and efforts. Let's continue to work together to keep our communities informed, safe and resilient.
The government and public health play an important role in promoting and spreading awareness about wearing a mask. For example, sticking large notices and advertisement on a wall.
Next, all citizens should maintain cleanliness by washing hands with soap after doing any activities. Besides that, wearing masks is essential every time we go out or went to a crowded places. Apart from washing hands, we can also use hand sanitizer after touching any surfaces. It is to avoid spreading the germs to others.
Let's do a SWOT analysis to help us assess the external and internal factors during the COVID-19.
We have a strong healthcare system and infrastructure. This can be seen in additional medical staff and hospital in Malaysia. Plus, we have MOH efficient healthcare system. This helps our country reach the goals to manage COVID-19 smoothly. MOH should introduce an online application for all citizens earlier. For example, My Sejahtera application to track every citizen health update and vaccination. This should have been earlier in our country so that every age of citizen knows how to use the application and reduce the workforce physically.
The public and private sector of medicine made a collaboration to stop the virus from spreading widely. The information towards the citizens, this can be seen in fake news and social media. Ministry of Health should put on their news on official social media platform to ensure that the citizens can get their information authentically. That's all from us.
Bye.
Bye.